Welcome! You are listening to the CRM Success Show, where you will hear from CRM executives who have overseen some of the most interesting and complex CRM implementations. Your hosts, David Masri and Kira Whitey, will be bringing you real stories, real insight. Follow along on social media for updates on new episode releases, exclusive content, and much more. Enjoy the show and thanks for listening.
Welcome to the CRM Success Show, where we deep dive into CRM success and failure, delivering real stories with real impact. I'm Dave Masri.
And I'm Kira Whitey.
And today we're talking with Hans Tiefenthaler, the Director of Salesforce and CRM Platforms at Access TeleCare. So welcome, Hans.
Thanks for having me. Great to be here.
All right, Hans, we're going to keep it real simple to kick things off today. Please give our listeners an overview, couple of minute version of your role, background, and current company you're supporting.
Yeah, so I've been doing Salesforce for about 15 years. Started in-house at Constant Contact, the email marketing software provider. Got my start there, went to Athena Health for a couple of years and built out basically like CPQ using Spring CM, which is a pretty complex solution. And then was at Gear CRM, now Raptor One, for 7.5 years. So went from being a senior consultant, running the projects, doing the test scripts, building out different functionality and, working with our customers, and then, kind of progressed into the solution architect path there. So a lot of that, became basically kind of the upfront hybrid kind of pre-sales as well as delivery. And so working with customers, defining what they needed, working with the project team, getting things baked, and then kind of starting to back off as they were off to the races. And then was at Rose Tree Solutions for about 2 years, and then went to Thunder. And then I ended up coming across this role at Access TeleCare as a CRM director or director of Salesforce and CRM. So I joined in November and have been here for just over 3 months now.
Fantastic. So journey started out in-house with Salesforce, correct, at Athena Health back in 2013.
Constant Contact way back when, yeah.
Even prior, so
2010, yeah.
Yeah, okay. So in-house, decade of consulting experience for some big name partners, and then doing kind of full circle moment by joining Access TeleCare, and like you said, just kind of done your first full quarter with the business, correct?
Correct, yeah.
So for those who might not be aware, Access TeleCare, my understanding is that, and you can correct me, Hans, if I'm wrong, but they're essentially a telemedicine provider in virtual care solutions, hospitals, health systems, and so on. Correct?
In a very basic sense, yeah. We call ourselves a technology-enabled physicians group, and so a little bit different about what we do is we have specialty providers. So we actually run code blues, acute stroke, septic shock, different, true specialties. We have infectious disease specialists, maternal fetal medicine. So if you have sniffles and you're like, hey, should I get some antibiotics? You wouldn't talk to one of our doctors. We kind of say people talk to our doctors on some of the worst days that they have. So very, very kind of niche and a little bit different than the standard kind of telecare, but definitely within that realm.
Awesome. And I did a bit of research prior. 1 out of 5 US hospitals you cover, which is quite phenomenal, really, especially for, I always like to see a company based out of Dallas as well, being an honorary Texan living here now. So Dallas-based business, been going for about 20 years, serving 20% of the hospitals in the US, 7 million patients, I was reading. So carrying your weight in the space, it's fair to say.
Absolutely, yeah. It's very, very cool company, very cool space, and I think what's great too is that within underserved communities, less affluent zip codes, that they're able to now have access to specialty care that they wouldn't normally have. We hear all these stories of people that are in a hospital that don't have the specialists that would have had to ship them out, or medevac couldn't fly, and one of our providers is able to help save lives.
Good stuff. So really, real good business, doing real good things, serving people who need it most. So So your role, Director of Salesforce and CRM Platforms, what does that encompass?
So a lot of what it says, but it's a pretty dynamic role. So I've got a handful of in-house folks and then a handful of contractors who are offshore. And so we work to basically develop Salesforce and customize it to meet the needs of the business, as you might imagine. And my role kind of spans everything from leading the team, leading the architecture, working with the team to make sure that we've vetted the designs is going to work with what the business needs, and then also a bit of project management, working with our project manager, and kind of stakeholder management. So it's very dynamic and a lot of fun.
Good stuff. In terms of the usage of Salesforce, how is that currently used? Is it core cloud? Is it health cloud? Are you doing anything on the FSL side? What does that look like?
Yep. So we've got sales service, and then we are in the middle of a large, complex field service implementation, which is pretty unique too, because it's we're not actually dispatching providers, right? They're all remote. So we're using field service mostly for the scheduling engine, and trying to optimize, between different facilities and different time zones, providers who are available in different time zones at different times of day, and also physicians who are able to work at a facility based on their state license, their credentialing within the facility, their privileges to work within the facility, and their specialty, and then trying to kind of line all that up so that we've got the best care and the best coverage for our customers.
Fantastic. And rough size in terms of number of users, Salesforce users, what does that look like?
So we have about 300 internal users, and then 700 or so clinicians who they don't really log into Salesforce. They're more set up just so that we can schedule them with field service.
All right. So you were brought in just over a quarter ago. I guess what was the mandate? Why did they bring you in?
The other director actually decided to go from in-house back into consulting. So we kind of ships passing in the night. I went from consulting back to in-house.
Oh wow! So you guys swapped.
Yeah.
So what did you walk into? Like, were you in the middle of a project? Were you getting something started up? Was it a mess?
Yeah, it was the team had been working really hard, and to get field service out of the ground. We previously were on Shift Expert, so like the legacy Click software field service model, and that went end of life on January 25th this year. And so we were up against a deadline trying to get everything in. The project, the team is super resilient, has a lot of tenacity and grit, and they made it work, right? And so basically kind of launched field service, I think about 9 days after I started or so. So I was more in the passenger seat for that, but we got that live. Given the timeline, I think we definitely saw a lot of bugs, a lot of issues, and different things that needed to get cleaned up. And so December, end of November into December was a bit of a firefight, just kind of stabilizing things. And as we looked into it, the team had gotten into a point where we needed to make it work, and the way the kind of, it was a little bit more of a brute force approach at the end. So using Apex basically to create service appointments and get them available so that people could be scheduled. So my first few weeks were really kind of working with the team, understanding where we were, and then trying to kind of figure out how we could use more native field service functionality. And so going into January was really more of like a re-architecture exercise, getting maintenance plans, work rules, those kind of figured out so we could move away from our custom work and into the native engine.
So it sounds like you came in 9 days later, they launched, and then you immediately ran into some issues. Was that like planned? Like it was a planned fast follow, as you would call in the consulting world, or was just like missed requirements? Like what happened there?
I mean, the business is super complicated, right? when a service appointment is completed, we have our proprietary software that looks at the service appointments to figure out which doctor, which clinician's available. And that does the routing, like kind of if a nurse enters an encounter for a patient, it's going to say who's on shift and then route it outside of Salesforce. As those encounters come in and people are saying, what was the ICD-10 code, basically, like what are we going to bill for? What should the clinician be paid? All that runs back in Salesforce. And so there were a lot of just a lot of complexities that I think weren't uncovered with the timeline that the team had. And so it was just a bit of cleanup, and probably could have benefited from additional time testing. And then there were also, moving from shift expert into into field service, because it was all new objects, right? All the 900 reports that people ran to tell a facility which provider was going to be on next month, those all had to be rebuilt. All the list views that they were using to filter and see who's on shift, and do I have a gap in coverage? Do I have enough, coverage here or not? All those had to be rebuilt. So it was a lot of kind of catch up, in addition to some stabilization of the downstream automations that we have.
So it sounds like, and maybe I'm misunderstanding, but it sounds like, sorry, so again, you started there, you launched. Was this planned that you were going to continue to build out field service, and make tweaks, like that was expected? Or did you have like, I'm starting here, let me get past field service and start a new project that I can own, start to finish?
Yeah, so it was, it was a planned phase of the field service rollout. And I think that, our next kind of phases and what we're working on delivering this quarter, one is the ability to get availability from providers. So having an engine running in Salesforce so that 700 people, based on, are they going to sign up for 3 8-hour shifts or 2 12s or a 24-hour shift, or whatever it might be based on the type of work that they're doing, to be able to have our proprietary app actually on a mobile app present to them and say, I can work these days, or I can't work these days, or whatever it might be. So we've got that. And then one of the things that came out of some of the customization around creating future dated service appointments to schedule was that it was a bit more manual than we would have wanted for our scheduling team. So just based on the batch processes, or the triggers actually, and the volume that they could handle, there was a lot of kind of like repetitive clicking, multiple clicking. So making that a more streamlined process, which is where we went to maintenance plans. So those were kind of like some of the immediate future phase follows. And then basically getting off of shift expert, allowing our providers to be schedulable. And then the next, kind of holy grail that we're going for is the optimization engine. So being able to look across all the service appointments, all the service resources, and say, this is the right person for that shift at that facility. So that's next quarter that we're targeting to start building out that.
So that sounds interesting. So you're going to match. So somebody says, I need an appointment. Does the facility really matter? I mean, because it's telehealth, right?
It does. Yeah. And so there's, it's fairly complex. So one is you have to be licensed in the state, right? So if you came out of med school and you've been practicing, in Massachusetts for forever, maybe you have a New Hampshire license or something like that. But you're probably more a doctor that goes into a facility, so you only need one. Some of our providers are licensed in all 50 states. And once you have a license in that state, then the medical facility has to basically credential you, which is saying you don't have malpractice suits out. We, call the facilities you worked before, and they validate that you did good work and that you're credentialed there. And then there's a thing called privileging. This is all new to me when I came into Access TeleCare too. So basically, it's like getting hired by a hospital, right? So you're saying, hey, this doctor can work here. They're a good doctor. do you agree to have them on your staff? And then there's a signed agreement between the physician and the hospital. So we have all that. And then there's also kind of the human component of it, which is saying that if every time a nurse goes into the screen in the room and she gets a new person, there's no rapport being built, there's no trust being built. It's just kind of like that box and you get a face. And so being able to have physicians focus it within a group of facilities so they do have that kind of interaction with the hospital staff that's on the ground is another important element of it.
So though your clients are in the hospital, they're home, right?
No, they're in hospitals. So the people that pay us are the hospitals, basically, right? So we sell physician time, physician encounters, and then medical director time. So medical directors could, advise a hospital, here's the new things that we're seeing, here's how we should manage this differently, et cetera, et cetera. And then we have the actual NPs, APPs, and their supervising physicians or other, MDs, DOs that would be working at the facility. So that's, I think that answers the question, but
I think so too. Yeah, I kept thinking that the patient is scheduling it directly, and sounds like that's not.
Yeah, it's not like Teledoc or something like that where you're going online and saying, "Hey, check this out." It's you're in a hospital because you just had a stroke.
Right. Yeah. I mean, in terms of a business model, obviously that's probably one of the reasons you had so much growth, right? Is because your accounts are much bigger. It's much easier to target hospitals, I guess, B2B, as opposed to a B2C.
Yep. And it's also good for hospitals too. If they've got a great neurologist or infectious disease expert, but they only work 7 a.m. to 7 p.m. Monday through Friday, they can cover the nights, they can cover the weekends, and we can fill those gaps in coverage for them.
Awesome. All right. So let's go back to the tech. Right. So yeah. So how'd you get started? Right. So were you handed a mandate of, hey, these are some goals you want you to accomplish? Maybe you inherited it from your predecessor. Did you put together a new plan? Right. Yeah.
Yeah. So my boss is the CTO, and she actually built Salesforce and a lot of what we have from the ground up starting a long time ago. So she's actually very sharp and has been a great resource. And so she's got a bit of the roadmap in her mind, which has been helpful as I'm just kind of trying to get my hands around everything. But as far as kind of like the how of certain things, that's been, hey, we need to make this better, like go figure it out. So that was, going from our custom Apex to create service appointments to using native field service maintenance plans. Those were some of the decisions that I made and then worked with the team so we could figure out a plan to get that in place.
So what's your plan?
Plan right now is, so we're availability with providers. We're going to do the, automation of the blank future dated service appointments, move into optimization. And then I think, at that point we've got, the company was a number, Access TeleCare is a number of other companies that have kind of come together through acquisition over the years. And so we've got a lot of bringing and folding different groups in, standardizing their processes into the, field service solution that we're putting together. And then, what I've seen is there's a lot of kind of low-hanging fruit around, just page layouts, workflows. Some people are still using Classic, a lot of that stuff. So my approach, and have done this with a number of customers in the SI days, is really to be able to kind of step back, walk through workflows with people, and kind of do like that whole business process systems review. So we can say, all right, how are you actually using this thing? Let's figure out what features you need, and then create a plan to kind of roll that out and streamline things overall. So I think there's a lot of case management in the future that we're going to be looking at. I think that there's, definitely some things with our call center and telephony that we're going to be looking at, and really trying to be able to streamline once we get the scheduling piece and the optimization piece figured out.
Cool. So I'm going to apologize in advance for this question. Hopefully you don't say anything that gets you in trouble. But your boss, you said, has been there for quite some time.
Mm-hmm.
Built the current instance. So it seems like she's probably heavy client side. And you came from a heavy consulting side. I'm sure you had a lot of, let's say, different experiences and
Mhm.
maybe different ideas on how to do things, how to do different design. Um, so any adjustment in working with her, or maybe you had to pivot things. How's like that? I say, let's say, relationship dynamics slash the planning adjustments going.
Yeah, no, I mean, she's been, as I said, super supportive, really helpful resource when, I'm like, oh, we had someone was asking for a feature the other week, and I went to her, I'm like, why don't we just do this? I think I've got, a couple hours for the team, and we've got a little bandwidth right now. And she's like, no, that's, that's going to be a whole can of worms if you open up that, right? So having her guidance as far as kind of blocking and tackling, I think that, probably to your, where would I get in trouble in the response would be that, there is a lot of history there, right? So here's how that team works. Here's why this might not work, those types of things, and kind of working through that with her. I think that there's also, from a consulting perspective, and we had a business requirements document, or I was handed a business requirements document that was developed and kind of finalized, signed off on last summer. And if you went to an SI and said, hey, we've got our requirements right here, we finished them up 6 or 7 months ago, go build it, the SI would say no. Right? Like, we're going to do discovery, we're going to charge you for the discovery, we're going to start there, and then we're going to get moving. So that was a little bit of a, it's not the way I would have wanted to approach it, right? I would have wanted to do the consulting path of saying, let's go through it again, let's validate everything, we'll come up with a plan and then go. So it's been a little bit of a juggling act from there, but I think I also didn't have to give them an estimate and a timeline. So we're working through it together, but it's been a good partnership.
I don't
It's
believe
interesting.
timelines. Sorry. Yeah, go ahead, Kira.
It's interesting. We recently did a recording with a director of Salesforce, and it was heavily focused on the importance of getting the requirements right. And I think one of the biggest bits of feedback we hear from SIs is around the documentation piece, right, or lack of it, when handing back the reins, so to speak. So again, you're coming from the flip side of that now, right? And somebody else in theory has been in the driving seat for a long time, and you kind of coming into the back end of that and trying to reach the speed and kind of I guess position of the implementation, whereas maybe from an SI perspective you'd be more so at the start, I think, or like more emphasis on, you'd have more control over the requirements, at least because you're part of that initial exercise, as you mentioned.
Right. Yep. Yeah, absolutely. And, there's obviously everyone's got a big backlog, and we've got a big backlog. And one of the things that I've been trying to kind of institute as working with different stakeholders is saying, we're not going to be able to do that for 3 months. Right. So I don't want to talk about it right now, because in 3 months, something's going to change. And so being able to kind of get that roadmap. So it's like, all right, we're going to have bandwidth. Now let's define it. Now let's sign off on it. Now let's build it, so that we're not, tying something with a nice bow and then putting it on the shelf for a few months.
Mm-hmm. So in terms of the industry, obviously there are nuances with healthcare. We often hear businesses, they like hiring individuals that have that healthcare experience and exposure due to all the kind of, like I said, nuances, terminology, right, HIPAA compliance and so on. I know you started out your career in Salesforce, you did a stint in the healthcare space. What about through the last decade of consulting? Were you like, what percentage of projects were healthcare focused, would you say, if you had to kind of round it up?
Round up to about 1%.
Really? Yeah.
Yeah. I mean, we worked with like a life sciences company but they were basically a consulting company. And, but yeah, I mean, it's definitely a unique, nuanced industry. Fortunately, from my time at Athena Health, I knew what an ICD-10 code is. I know some of that stuff. but yeah, it's definitely a learning curve for sure.
How much has changed since 10 years ago, when you were back at Athena, compared to today? Not just in terms of like the industry, but also Salesforce and how it's supporting healthcare businesses, or how it's used by healthcare organizations.
So that's a good question. I mean, I think I haven't seen a huge difference, honestly. I think that now we've got more AI, and so there's a lot of, that conversation, right? Because you've got HIPAA and PII and PHI and all that kind of stuff, and kind of how do you handle that with AI? So that's been the big question. Athena Health, I don't even think Health Cloud existed when I was there, and we're not on Health Cloud, so haven't had too much exposure to that to really be able to speak to it.
Mm-hmm. Makes sense. And therefore able to leverage kind of your core cloud experience over the years as well. Pretty much plug and play, just different language in terms of the industry, right? So
yeah.
So before we move on to some, questions around comparing the consulting space and in-house, which we're going to cover shortly, a little bit more about Access TeleCare. So again, you're a quarter in now. You've kind of done this main project in terms of getting it to go live. There was some other stuff that you were busy doing around the DevOps process and Scrum and so on. Do you want to elaborate a bit more on those topics?
Yeah. That's actually been a huge win in the near term as far as working with the team. And coming from an SI, right? Like, you literally manufacture projects. That is how you make money as an SI. And so within that, you're doing story points, you're doing billable hours, you're doing, what are your project dates? Are you hitting this? What are your dependencies? Lots of communication, lots of those types of things, right? And I think coming in with the team and the deadlines that they had, there were old tickets from 9 months ago that were still in new, but they've been deployed. People had different ways of working, and it was very, very collaborative. A lot of smart people working really hard, but not necessarily working in more of a kind of that linear process-oriented fashion. And so one thing that I basically said was, if we look at the kind of consulting standards of utilization metrics, right? In consulting, it's 75% utilization for your delivery team, typically for an onshore resource. And, using that to back into how many story points should we be able to do? And being able to track our DevOps tickets and close them out and assign story points and put estimates on things was not a big change for me, and something that I kind of figured would be like, yeah, let's do that, right? Let's figure out how much this is going to take and figure out how much bandwidth we have, and then we'll deliver it on time. And I think it was probably more of an adjustment for the team than I had anticipated, and might have made people uncomfortable, as we're like, hey, let's kind of go with what I viewed as kind of industry standard. Mm-hmm. But it probably took 4, 5, 6 weeks, a couple of sprints, and then people are starting to say, wow, that was a lot more efficient. That was a lot calmer. That was much more predictable. And here's why something slipped, or here's what I need differently in the next sprint. So to be a little bit more rigorous, and PM and overhead, like it can add a lot, and it can be inefficient if you're doing it too heavy. But I think by putting in some of these guardrails and figuring out how much people can accomplish has been super helpful. We also, going into this quarter, we're doing the architecture, we're trying to figure out what's happening next. Finally figured out kind of our high level user stories, put story points on them. And by that point, we had actually had a couple of weeks of our DevOps tickets getting closed with the user stories or the story points assigned to them. And so we're like, hey, we've got 25 points that we need to do in this sprint for this body of work, and we're averaging 32 points on our sprints. So we're okay. We can do this, right? And I think it gives everyone a lot of confidence that we can do the work. And it also gives me confidence that I'm not going to burn someone out or ask too much of the team when we're trying to target a deadline.
For sure, and I think it also allows you to establish some quick wins, right? And almost kind of instill some confidence internally, right? So you talked about a bit more process, bit more standardization, maybe were kind of the first few things in that kind of 90 days that you were keen to embed into the organization. As well as kind of just your rapport building, getting to know the history of the org and so on. Anything else that you were keen to ensure you carried out in terms of an exercise within those first 90 days, right? If there's someone else that is following in your footsteps, making that similar, not just necessarily just joining a new organization in general, right, and applying more of those kind of lessons learned from consulting. What else did you set out to achieve in those first 90 days?
I think it was also building trust with the team, right? So credentialing myself with them, of being able to say, this is what an architecture could be, bringing them along, and I think when you start to go, we're going to start tracking story points and we're going to start tracking output per sprint, people can start to get worried about, like, what if I'm not doing enough? Is he going to get mad that I didn't accomplish X, right? So making sure that people knew why we were doing it and the importance of it. And then, I think that, again, it was probably more uncomfortable than I would have wanted initially for the team. But I think that as we got into the groove, it was like, oh, cool, this works. Now I can accomplish my week. I can sign off on Friday. I knew I did a good job, and I'll, sign off for the week and then start again next week.
Yeah, I think rather than being seen as, just being the new guy, new guy with new ideas just for the sake of it, right?
Right.
At least providing that story as to the why we're doing things this way, and how it will benefit. And hey, turns out you were right, even better kind of thing, right? So, good. All right. So, Matt, I know you had a question.
Yeah, maybe. Like, what are the core differences? It's always interesting talking to people who make the switch from consulting to client side, in terms of the overall, say the thought process or the psychology behind it, right? Because you're always thinking in terms of business process improvement. There's no contract to kind of guide. So how has that adjustment been for you? Do you think coming from a consulting is a benefit when moving to client side?
Yeah, I mean, I think absolutely. I mean, you have so much more experience across so many different projects. What's been interesting, though, is some of those, long-standing, lesser used corners of the Salesforce universe that, as an SI, you don't really hit, right? So I was doing an opportunity history report for one of our sales leaders, and I'm like, I haven't looked at an opportunity history report in like 10 years, right? And so some of those kind of things were definitely different. Preparing for releases and trying to figure out what are we going to do at downtime, and we're moving to Hyperforce in a couple of weeks. How are we going to handle that when people can't? The system's on read only. So those are definitely different. But I think that the execution on a project and how to think creatively, how to manage stakeholders, and doing that for a long time across a lot of different use cases translates really well to any business.
What about like end user support, right? Because usually the SIs will say, you give us a point of contact and we only want to talk to that small group of people, right? Obviously,
Sure.
Here that's not the case. How's that been? How did you structure that?
So we're using cases, as you might imagine, we don't have a huge volume of cases, and then basically, one change is that essentially, if the case is like under 2 hours, if we can fix it, it's a report, it's a permission issue, someone has a question, password reset, whatever, just take care of the case and close it out. But if it's going to be an adjustment to a flow, if it's going to be something that's going to take a little bit of work, we're assigning a DevOps ticket to it, or associating a DevOps ticket to it, closing the case, and saying we'll get back to you when we can get this prioritized. So
Is that
it's
the same team? Sorry.
What's it?
And that's the same team, or you have a dedicated team dealing with support?
Same team. Yep. So we it's a pretty pretty small team, right? So we've kind of have two. We have a admin and a developer, and our developer can do both admin and development, and our admin actually has some development experience as well. So from from a role perspective, that's what we have, and then myself. So I'll try and grab a case here and there just to kind of help take that off the team, but we're basically kind of monitoring the queue. Anything that's high priority we'll take care of, and then also trying to work with our counterparts on the offshore team, so that if there's certain things that are well defined that we can just pass off, we'll ask them for help for those things.
Okay. Hero, you want to move on to our next topic?
Yeah. So general, not necessarily pros and cons, but observations between consulting and in-house. So before we dive into that, Hans, I know we talked offline a lot about this was a proactive strategic choice of yours to move back in-house, right? It was something that you were pretty adamant, unless it was a game, a life-changing opportunity, you were going back in-house, right? So why was that? Because other people, some people have 20, 30, 40-year careers in consulting, right? And they do perfectly fine. But what was it for you that kind of sprung the urge to get back in-house?
Yeah, I think I was looking for a bit more of a dynamic role. And back in the day, in the gear side of things, when, Salesforce was going gangbusters and AEs were knocking on the door, can you please help me scope this? And, it was a lot of fun, right? And then, from a sales perspective, where I'd spend a lot of time in pre-sales, that became more knocking on the AE door and, asking for things, and more on like the actual sales than just kind of having fun making cool projects. And so I ended up going back into delivery, and then it's kind of like you're really, as an SI, I think to survive now, you're either super specialized, right? Mm-hmm. And that's what you do, or you have to be total cutting edge, right? And you're working with your partner account manager, and you're trying to get access to pilot programs and get access to have your hands on the new tool that's coming out, so you can stay relevant, so that you're the only partner that people can go to. So the space from a consulting side, I think is less fun nowadays, and so
it's harder.
It's harder, yeah, absolutely. And within delivery, it's kind of same thing, as you're either going to be very, very technical or very technical in one area, and you kind of end up in that area. And so, I wanted the chance to, kind of go back to leading a team, going back to working with the company, and really kind of making my mark on a longer term roadmap, and also like eating my own dog food, right? So you can architect things all day. You say, here's how it should work, and then, you finish the engagement, but 6 months after that, I didn't have the chance to see those results. So I think I did an all right job with the architecture, but didn't get to say, have end users say that was great, or to be like, hey, that didn't work, right? And to learn from that and get better.
So, Kira, I'm going to ask you to chime in on this after Hans answers. Sure. Was compensation a point in it? So I'm from a consulting background too, and then obviously I went on my own and started Cool on Digital. But one of the reasons I went out on my own was I was hitting pay ceilings, because in consulting you can basically only earn as much as you can bill, right? Right. And probably half that. So billing rates get suppressed, the market gets tight, even if you're still employed. You hit ceilings pretty quick, and then you have to kind of move into management. Was that one of your rationale, behind moving client side? Were you finding yourself hitting ceilings, or was it just that I wanted to know it's time for something different?
I think the SI job market is certainly tough right now, right? Even people that I know who are really, really good consultants with a lot of experience are applying and not getting callbacks. And so, I think there's an element of that that the market was just tighter, but I don't think anyone says I'm going to go from consulting to in-house to make more money. Right? It's
not,
usually the other way around.
yeah, it's not to make more money. It's because I'm talking about somebody who's really, really senior. So if you're at an SI and you're almost at the director level, let's say, unless you're going to the Deloitte, the PwC, you're gonna hit a barrier. You know what I'm saying?
Yep.
But if you go client side, you could potentially, go, I guess, what would be the equivalent of a VP level in the consulting side. I know the private sector VP is like lower than director. It's like it's weird that it's swapped. Right? Or if you've been a C-level. Yeah.
Yeah.
It's much easier.
I hear what you're saying.
Yeah.
I think, yeah. And you're right. Like that was definitely another factor, was like longevity and resiliency in my career. Right. So yeah, as I said, you're in SIs. I think that the tendency is either you get to a level or you specialize. But again, and I don't think that there's a lot of that like big law type of thing where you could bill 70 hours a week and make a bunch of money. That's not how the SI system in Salesforce is set up. And so it's more like, here, we're going to allocate you at 40 hours a week, and you're going to hit your utilization metrics, and you get a little bonus every quarter or whatever it might be. But yeah, I think that looking at my career and saying, between AI and the different things that are happening in the market and how Salesforce is working, and across the board, to be going in-house and being able to say, I can lead a team, and I can come up with great solutions, and I can deliver for a business, and I can do that overall, gives you a lot more options once you hit kind of the higher end or whatever you might call it of consulting.
Yeah, Kiro. So obviously you're a little bit close to this. What are your 2 cents on it?
Yeah, I mean, obviously we work with both sides extensively. I think as an individual contributor, absolutely, I think the pay is generally better on the consulting side. Think things like architects, right? I think the barrier, the salary is higher, the banding's higher, more often than not, right? And I think the likelihood of being hybrid on site is also significantly reduced, right, as well. Whereas I think I do agree. I think once you hit a manager level, I think it's more attractive from a comp standpoint to work in house, and we've seen a number of people, follow that trend over the years. I think also as well, I think it's more about you kind of touched on it, Hans, as well, like how deep you actually going with the stuff that you're building, right? Because generally the life cycle of a mid to enterprise customer, you're talking a couple of years max, right? And sometimes it takes a lot of time. There's different scopes, there's different statements of work. You're doing like one part of their project, which is like not even 10% of how they use Salesforce as a business. So like how much are you really impacting and being able to see things through. You mentioned I think you mentioned something about seeing eating your own food or whatever, right? But seeing the fruits of your labor, I think is what I often hear. And I don't think you get that as much on the consulting side. And it's interesting you mentioned there are a lot of people looking. Good people versus looking is another conversation for a different podcast, but there is a lot, but how much a top 1, 5, 10%. But you're right, SIs have typically traditionally specialized, and then those areas have been so focused on, let's say, CPQ for 3-4 years, right? Where most businesses, either SI or in-house, won't just hire us. In-house, definitely unlikely to hire just an SA to focus on CPQ only, right? They want a broad core cloud, SA who also knows CPQ. So it's challenging, right? So I think typically what I hear, money's maybe like a small factor in it, but it's usually the ability to go deeper with more of like the roadmap for Salesforce and other systems, as opposed to just kind of smashing out statement of works, proposals, pre-sales, etc. Right? It's a different feeling.
Absolutely, yeah. I mean, it's, just there's so many different things that in the past, 90 days or so that I've been like, oh, that thing, I gotta go look that back up and, refamiliarize how that works. And so, I think the dynamic, right? It's you bounce around and get deep in things, remember it. It's a different way of learning and growing, because that's the other thing is, in the SI thing is like, you can work for 8 companies, you can do 12 projects in a year, right? Where in another company or in house, that can be the frustrating point for people, is like, I've been slogging on this project for 9 months, and like people, I'm just plugging away, right? And so I've actually had kind of the opposite experience, where it's like there's just so many different things to focus on. That's been, refreshing.
You ever feel like you're not in tech anymore? So I can tell you what I mean. I interviewed for a relatively small shop some time ago. They happened to be a water company, and one of the decisions that I decided to turn down that position, it was an interesting position, was I felt like I would have to go into the water business, um, right? Because it's just like if it's such a completely different mindset you're looking in terms of, right, of growth, of servicing customers. Your focus is not on the technology. Where in the consulting, you're constantly looking to, okay, what's the next tech to learn? Do I got to pick up an AI? Do I got another cert? Right?
Mhm.
It's again a very very different. With you're starting to feel any of that. Um, I know at a larger company it's definitely different because you're surrounded by tech people.
Mhm.
Than probably in a smaller company where you're dealing directly with, like, the business leaders, or only with business leaders.
Yeah, I mean, I think it's a little bit of both, right? Because I think that, to your point, you do have to know the business. You have to be an expert in what your company does, um, and you can't just say, well, yeah, if you just put these objects in a trigger and X, Y, and Z together, that this will work, right? It'll meet the requirements. So there's a lot more of that context and the people part of things, and making sure that you're understanding what the end users really are kind of going through on a day to day. But at the other point, I think that at least from an Access TeleCare standpoint, we have such a unique business and such a unique way of doing things, and with the different companies I've acquired and how different people work and how their businesses operate, successfully, there's so much customization that has to happen that it's almost like we're building custom applications within the Salesforce framework, almost, So trying to use as much standard functionality as possible, of course, but there's a lot of like application development that's going on as well.
Good. Couple of quick questions for your hands on general comparisons. Answer them as you see fit, right? Choose to pass. You can have one pass. Quality of talent, in your opinion, is it higher in the consulting environment or in-house, from what you've seen?
So I think I've got a great team. I think that in consulting, a lot of SIs can be really, really, really picky. And so you can get really, really, really talented people, but it depends on how the team works together too, right? So just because you have a bunch of really talented geeks doesn't mean that they can do what they need to do.
Mm-hmm. I think I often hear how consulting gives you that variety. You talked about the variety as well being one of the biggest benefits of consulting. But you're absolutely spot on. I think we're seeing more of a shift towards, I don't want to call it soft skills, but it is the ability to elicit and gather the requirements. It's the people skills, right? The ability to ask, like, well, just because we can do it in Salesforce this way, why are we doing it that way, right? Is that actually just because you can do something doesn't mean you should. Whereas I think consulting, it's very much like, okay, it's in the statement of work, just do it, right?
Totally.
So it's
and you
different
can get
skill
into
set.
those situations where you just, customer's always right, even when they're not, at some point, right? And you're like, I got to close out this SOW, and you just do it. So yeah, that can be, yeah, it's tough too. Cause as a professional, you want to deliver a good product. You want to deliver something that's going to last. And if your customer says you got to just do this stupid thing, eventually you have to do it. Which is the bummer about consulting sometimes.
Let's say fast forward 3-4 years, right? Maybe the answer will be different in 3-4 years, but let's say fast forward 3-4 years, you've done some good stuff with these guys. Do you think you'll stick out in-house, or do you think you'll miss is there any, I guess let me phrase it differently. 4 months in, anything you miss about consulting? Is there anything that would tempt you to go back to consulting in the future?
No. Short answer, no. Yeah. I mean, my role before, I was a solution architect, right? And so I had a lot of control over my day. I hit my utilization, and I could bill aggressively and be efficient in my work and sign off at the end of the day. And so now I've got a team that needs help. I've got an offshore team. I've got 24-hour, 24/7, 365 users of Salesforce. So shutting off is a little bit harder. But not in my mind, the experience and the folks I'm working with, it doesn't offset that downside to it.
Are you working, would you say, harder typically as an individual, less so as a leader, but from an individual contributor standpoint with your own deliverables, would you say the expectations are harder in SI versus in-house because the notion of, well, clients paying for this kind of thing?
So, I work my pace, which is pretty hard. And then, but I think that it's much more clear cut as an individual contributor in SI. Here's what you have to do. Here's the deadline. Get the work done. Right. I've always kind of thought in my experience, I'm like, yeah, if I get into an org for a month, or if I can talk to a couple of people for a couple hours, I'm going to understand what's going on. And I'm still coming way up to speed on all the different custom things and applications and all the things that we're doing in our org. It's really complex. So I think that's why, right now I'm working more, at a higher rate, higher number of hours and whatever that than I typically would expect.
Again, not necessarily thinking about just in general. Obviously, there's a continuation of layoffs here and there in the ecosystem. Talking Salesforce layoffs. I think it is easier to risk, assess, and less likely to face a layoff in a consulting partner than it is in-house. Or again, that's like a general question, because I know it depends on where they focus, what percentage of deals an SI is getting from Salesforce and so on, where they rely on. But in general, do you think there's more opportunity for longevity in-house or consulting?
I think from a career stability, job stability, and obviously, tech has been hit hard and all that kind of stuff just across the board. But I would say in-house probably is a bit more stable. Because, at an SI, if you're not bringing new deals in, if the overall utilization rate's going down, they have to cut people, or they're going to, that's the nature of the business.
What did you maybe underestimate in terms of making that return from consulting to in-house? Was there something that you thought, I could have maybe been better prepared for this?
Honestly, it's kind of funny because Access TeleCare, so we're PE owned, right? So that adds a pace to the business, right? If you're a giant 20,000 person shop, you can expect things probably move a little bit slower. but I think that the pace of the business is more than I would have expected for an in-house shop, which is good, right? Like I didn't need to go out to the farm, for at this point in my career, but was thinking it would be a little bit slower paced than it is. So that was actually a bit of a surprise, and but that was I think the big underestimation of kind of the level of work and the workload and amount that has to happen. Also kind of interesting too is the resource constraints, right? If you're an SI, you've got a project, someone scoped it, and assuming that they didn't try and lowball it and they didn't discount the hours, they discounted the dollars and not the number of hours that they're billing for, you've got the time, you've got the people available to do the work. And when you only have, here's what you can do from a hiring perspective, that's your bandwidth, right? So that turns more to stakeholder management and team management to figure out what we can actually accomplish versus like saying, here's a check, here's an SOW, here's a scope, we're going to do it.
Makes sense. Maz, over to you.
I keep going on mute. This thing is weird. Anyhow, so I think when you start a new job, generally when they're hiring, they have a need. So you'll often come into a very busy shop when you switch to client side because that's why they hired you, right? And that's why they had a spot. And then it kind of slows down. Going back to stability, I think one of the nice things, if you want to call it a nice thing, of working at an SI, if you're going to let go, generally you'll see it coming because there's a slowdown and you're not hitting your hours, or you can see the pipeline. I think when you're in house, what often will happen is like they'll talk about budgets during their, I don't know, the powers that be quarterly retreat or whatever, and then they'll just come to you and say, "Oh, Salesforce budget next year, cut your staff, and then we'll pick up projects, in 2 years, keep the lights on," something like that. So what was stability part of your thought process or at all when thinking of in-house versus consulting?
Yeah, absolutely. And I think, one of the SIs I had worked for, went from, I was, around 50 employees when I started, around 35 when I left. And that was, not a happy time, right? And no one wants to be in that situation, including the leadership, right? And they're doing everything that they can. But then, just looking at it, in the next SI of how hard they had to sell just to, to feed the beast, right? And so I think that's it's tough, right? It's Salesforce, AEs are doing everything they can to bring in deals. I think a lot of people have Salesforce already, right? And so they might add a module here, but like right now, people aren't doing $2 million investments in technology, with interest rates going up and all that kind of stuff. So it's a tough time, as an SI to survive, which is, means you got to be more willing to cut your resources if you need to.
Cool. So we always end with this question. So I know you've only been there a few months, but what's next? What's next for you? What's next for Access TeleCare? I'm sure you have a ton of plans.
Yeah, I'm really looking forward to getting the field service stuff going. I think it can be really impactful for the company as far as, helping people just be able to focus on new things, taking a lot of the manual stuff out, ideally making, our clients happier and also making our scheduling and, how much we're being able to make from a provider that's providing care, like being more profitable. So really looking forward to seeing the impact there. And then, I think that having that under my belt and being able to really kind of get Salesforce and the whole team just really operationalized, really running smoothly. That's kind of the near term. And then, from there, just see if we can keep expanding the team, keep doing better work and, keep going down this path.
Any agent force for you guys, you think, at all, whether it's next quarter or later on in the year?
Yeah, I mean, I think, yeah, 6 to 12 months or something like that. Start to look a little bit closer at that, but yeah, we got to get our hands around, certain things first, and then we start looking at cases and start, kind of figuring out what we can layer in there.
Get some of the basics right, by the sounds of it, before the advanced stuff.
Exactly.
Yeah, we want to see your scheduling agent when you get that done.
Yeah, I'm not going to say if, I'm going to say when we get it right, this will be it'll be a cool use case. I'm sure Salesforce will want to show it off. So
yeah,
it's really cool. Well, maybe we'll see you at Dreamforce this year then. No pressure.
Yeah, right.
Being invited to talk about it. All right. Any closing thoughts from you, Hans? Anything else you want to add?
No. Appreciate the time today. Thanks for having me on, and great to be a part of the show.
Absolutely. Well, we loved having you here. Thank you for joining us today. For our listeners, please do not forget to subscribe to the CRM Success Show for more episodes featuring leaders like Hans, who are truly shaping the current and the future of CRM. You can also follow on LinkedIn for more exclusive content. Thank you.